Welcome back to another episode of the Medcurity Podcast. The CEO of NWRPCA, the Northwest Regional Primary Care Association, Bruce Gray, joins Joe Gellatly in today's special episode. They talk about rural healthcare, the future of care delivery, and how AI and team-based approaches are making care more personal. Medcurity will be at the NWRPCA's fall conference this month, and we'll be hosting an after party with some of the other attendees, so let us know if you will be there. Enjoy the episode.
Hi, I'm Joe Gellatly with Medcurity. I'm so excited to be joined today by Bruce Gray from the Northwest Regional Primary Care Association. Bruce, thanks for taking a little time with us.
Absolutely. Thanks for having me.
I want to just start by asking about your journey. What drew you to the role of CEO of NWRPCA, and what keeps you in the role today? Because I think you've been in this role for a couple decades now, right?
Yeah, 21 years. I'll tell you, I was never that interested in healthcare. When I was in high school, I could not care at all about biology, but I loved physics. But it was an opportunity after grad school that through working at a federal agency, it was called the PMI, the Presidential Management Internship. And there was a whole job fair, and at it, one of the representatives from the Bureau of Primary Healthcare had a table. And I was walking by, and they said, "Hey, are you interested in perhaps working with health centers?" And I said, "No, not really. I'm not particularly interested in healthcare." And they said, "Well, let me explain." And they laid out the vision. Actually, it's interesting enough. Jim McRae was one of the guys at the table that day. They laid out the vision of what health centers really are about in terms of comprehensive care that is not just the medical care, but looking more broadly at that. And I got hooked. I was like, "Yeah, no, I'm definitely interested." So I interviewed. Things worked out. I ended up working for 4 years at the Bureau of Primary Healthcare in HRSA from 95 to 99, and then moved over to Capital Inc. for 4 years, and after that joined NWRPCA in this role.
So those job fair tables actually work.
They actually work. They really are good, particularly if you staff them with really dynamic, engaging individuals. You get drawn in. I was sucked in from the beginning.
Absolutely. That's great. So with NWRPCA, can you talk about the organization at a high level? What's the mission and the core values of NWRPCA?
Sure. It's really, as with many associations, it's really essentially to strengthen health centers. And we use a term around wellness, well-being, health, wellness, and well-being. And all three of those are very distinct in the sense of health is more the traditional medical care piece, the illness care that we provide. Wellness is really about more preventive care. How are we working in communities to think about keeping people out of the clinics, out of the hospitals, to really go upstream around that? And well-being is really thinking about what are the elements in community that really allow for people to thrive. What's the sense of community? What's the sense that encourages folks to feel positive about, the job opportunities, to feel positive about the transportation systems? It's really that comprehensive notion of community development. So for us, it's really how we work with health centers to look at all those elements, the downstream health aspects, medical care, looking upstream more at prevention, and then really thinking more broadly of healthcare as really community engagement and the elements of community involvement and community partnering that really take that next step around well-being for individuals.
Those are the key items that attracted me to being a board volunteer for many years ago and for many years now. And our company supports a lot of health centers, and that vision and that mission is you can see it in everyone you work with in these organizations. They've bought into it. They see how they can really affect health in a way that it's harder in other components of the paradigm of healthcare to impact healthcare as much as you can in a health center. It's really incredible.
Yeah, absolutely.
If
I could just add too, you think about the origins of the health center mission, it really was about that comprehensive approach, about addressing water quality in communities, about looking at brownfields, about thinking about what's all the elements that contribute. So it's great to hear in terms of your draw to working at a CHC board, because that's exactly what drew me too, is that sense of how do we approach these community issues at a much deeper, more comprehensive level.
Absolutely. So speaking of community, the Primary Care Association is this organization that can help the health centers learn from each other. How do you go about fostering collaboration between the various health centers across the region?
A lot of it is one of the key roles we play is convening. we have our, as you know, having Medcurity been participating in these, we have our conferences in the fall and the spring. We've done a migrant forum for many years. And I mention that because it's honestly bringing folks together. It's that networking. Obviously, we present, content and sessions that help bring innovative approaches and ideas together that can get people excited, take back and explore at their health center. But really, it's even just the networking, folks coming together, serendipitously having conversations with each other about some of the challenges they're experiencing, how they, can learn from each other and bring that together. So that's been really one of the fun things in my role and for us at NWRPCA is in structuring it so that we have the right national partners, our HRSA partners, our national partners from NAC, from other entities that have come there, and then setting it up so that we have right opportunities for folks to learn from each other and bring the best practices together. So that's one key thing around our convenings. Another area is over the years we've done certain projects that really have been more cohort based. That have right now we're doing what we call our Northwest Community Health Innovation Center, and it's brought together teams from 6 health centers to look and work with each other around broader notions of involvement in the community. How are they working with community partners to think of that original vision around that? We've been working with partners, the Ripple Foundation and community initiatives in helping to really think about thriving communities and the vision around partnering that gets beyond the downstream medical care, illness aspects of this. So that's, really it's very much around convening folks, listening carefully to what our members are experiencing, what they need, and then figuring out how we identify and bring subject matter experts, how we structure gatherings that really can help folks network and learn from these national experts.
And I can attest those conferences are fantastic. They've been a source of education and inspiration for years for me. We're very excited about the Spokane location for the fall conference and bringing everyone there. So we get to play one of the many hosts in that area. So,
well, and if I can say, when we gather, having our national partners like Medcurity, the other folks there, our sponsors or exhibitors, it's very much a partnership. And so I think you and others who have come have really been engaged in the health center movement for years and know that it is around, it's not just there selling something. It very much is about how are we working together to actually really transform care, look at the right elements there. So we utterly appreciate, our partners coming from industry.
You make a great environment to build relationships in, and everyone's there for the mission. You can feel it when you're there. It's
Definitely.
Fantastic. So you've talked about a couple current initiatives. Is there any standout focus program of 2025 that's top of mind right now this year?
Yeah, well, it's funny you mentioned top of mind because we literally, I'll go to something that we just recently completed that we started about 7 years ago. We had funding from the RCHN Foundation out in New York, a nice pilot grant, and it was a leadership program that brings together public health and primary care folks, kind of a cohort that's equal balance between those two. Originally, we developed a leadership program back with the University of Washington, their MHA program, their Masters in Health Administration, and that was in about 2008, shortly after I started. That really was looking at how we bring together the key competencies, the key leadership elements as distinct from management. What are the leadership elements? Because of funding cuts at the state level, we had to discontinue that back in about 2012. But in our hearts, we knew we wanted to restore that, really have a program regionally that could give people help people with the competencies to really lead in their communities and lead in the nation on behalf of the Northwest. And so we started in thinking about restoring that. We realized that the time was right to think about it more broadly, not just primary care, but a partnership between public health and primary care. So we reached out to our partners at the Northwest Center for Public Health Practice at the University of Washington. This is pre-COVID. We developed a terrific program, and then, believe it or not, we kicked it off. Our first cohort was January of 2020. So 2 months later, the world changes dramatically. But people were so excited. The cohort there, we have about 24 to 30 people who participate over a 9-month period. The individuals were so excited about the idea of sharing across public health and primary care, learning each other's language, learning each other's objectives and how they're trying to understand that. And in fact, the timing was perfect in some ways that COVID reinforced the importance of working across different health sectors like public health, primary care, tertiary care. So we just wrapped up our, I guess I would make it our sixth cohort this last week, and it's there 3 times in person, or I guess twice now we're doing it. The last time, three days together that the cohort comes, and honestly, participating in that last day with the wrap-up sessions and talking about how we go from there, and just feeling the energy from folks, both on public health and the primary care side, to really think about how we tackle these issues, not only traditional care issues, but epidemics or things of that sort, but how we do that in a way that really cuts across sectors. So that's something that's fresh on my mind, and I just was very excited. I got very energized in hearing participants coming from public health departments, from community health centers, from a wide range of really, emerging and existing leaders in this area. So that's one thing. We have a variety of other trainings that I think really excite me over the course of the year. We have a Community Health Worker Institute that is really going gangbusters and helping health centers think about developing and maintaining community health worker programs, and also individual trainings for community health workers themselves. So those are some of the things that jump out. I know it's been a real time of turmoil and change in these last 9 months, but I do think there's opportunity and crisis. And so when we're feeling this is the time to think about who we really are and who we can really be.
You're creating those avenues, it sounds like, for some critical conversations, and like you said, convening groups together to discuss how we and actually put the work in on how we adjust our care model and maybe partner with our community partners in a way that we used to. I wonder, is there anything from a rural hospital, community health center collaboration? Have you seen connections being made between the hospitals and the clinics, community health centers, in any creative ways? Yeah. And have you?
Oh, absolutely. And in fact, we've done some sessions at conferences, even pre-COVID. There was a recognition that the model, particularly in rural communities, when you have a more limited workforce, you have opportunities to really think about synergies that go beyond, just the clinic providing a kind of a narrow band around primary care, and so in some cases nationally, there are situations where health centers have taken over and are operating a critical access hospital in their community, or you have kind of combinations where they're working together across the two around workforce development, how to attract and keep and train really good folks there. I know in Central Washington, there's some partnerships that are really looking at, OBGYN. How are we looking at, birthing models to really help young families stay in those communities? And so partnerships between rural hospitals, and particularly the critical access hospitals, the cause, and the CHCs around how we, really can look at urgent care, and where are there ways to combine efforts around that. I just think that's really where to me, the answer going forward is to think transformatively about how we're not siloed in these areas of primary care, tertiary care, public health, but we're really truly integrated so that we're doing handoffs. As a kid, I grew up playing soccer and loving soccer, and so the analogy I often use is, when you're on the field, and you get, players are being able to trade off. One player will do a run down the sideline to distract a couple of defenders, and you get an opening, you got another way. It's like that team-based approach, and team play is really, it gets exciting. It gets fun to kind of do those quick handoffs.
What do you think have been the ingredients in the successful conversations, or maybe even more formal collaborations? You mentioned even community health centers stepping in to run cause. Are there some trends in the communities where that's worked well? Does it just take a very community-minded leadership team on the hospital side, or anything you can highlight there? For, I know across the country, those conversations are at least starting. What do you think has made the successful ones happen?
Yeah, well, it sounds like a cliche, but it really is, the personality. So one, being open to change, and maybe putting your egos on the side to think about what could work best. Sometimes there's structural changes around kind of how institutions, the critical access hospitals and other hospitals and the health centers are working at. Sometimes it's just communication. It's relationships. What you saw during COVID is it really was the personal relationships that have been developed in individuals working together, at all levels within an organization. But, it starts really with that openness to working together, to collaborating, not just using it as an excuse to to write down in a grant that you're partnering together, seeking funding. To be cynical about it, it's like that takes you only so far. But if it's really genuine and recognize, okay, let's sit down and figure out how we in a rural community, how we really think about best attracting, talent, whether it's allied health positions, whether it's, clinicians, docs, whether it's administrative individuals, how can we work together to present kind of a unified approach where we're really interested in supporting that individual in their career development? And it might be that they work at the hospital for a period of time. Maybe we work at the health center. I just think that openness to nothing is ever static. When we talk about things are, seem stable, underneath things are always changing, right? So it's that notion of if you just start with that premise, then relationships are always changing. There's always opportunities, even if there'd been, in the past, differences of opinion between administrators, between the hospital and the health center and other partners. It's today's the next day, and you find ways to kind of move forward on that. I know having you guys as a partner at our conferences, I've seen that very much as well. It's like that openness to just building relationships, to dialoguing with folks. So I'll put it in kind of Pollyannish terms, but I think it starts there, and then recognizing that there are people, you can take on different roles in different ways, as a clinic, as a hospital. And to me, that's where it gets interesting. That's where it gets fun, being in community health.
Absolutely. That's really powerful. I'm thinking of a parallel. It's not exactly the same, but I was just speaking to a number of community health centers on artificial intelligence. And I was saying in a more simplistic form, but if it didn't work 6 months ago, go try it again. Like the world, not just AI, but the world, the world around us is shifting so quickly that just because maybe a technology seemed to have shortcomings or hallucinate or be less than effective 6 months ago doesn't mean it could potentially be a very brilliant implementation for you at this point. So things are changing too quickly to just make assumptions based off of historical.
Oh, absolutely. Well, and AI is a great example, Joe, as you think about, at a network, well, it's starting just at an enterprise level, an individual health center level. There's so many different elements, whether it's documentation, whether it's looking at communication or kind of sharing information. But then at the network level, across multiple health centers, you think about where AI can play a really interesting role in doing that. So it's terrific you had a chance to talk with the Virginia health centers. We need to have that dialogue, really anticipating where AI is going. It's that cliche about Wayne Gretzky about, yes, skate to where the puck is going to be, not where it was or where it is. And I just take that analogy a little bit further. Let's figure out how the game of hockey's even changing. Where are we even thinking about different ways of skating to the puck? So AI is a great way to jog our get our energy going in that area.
And potentially even driving the puck, right? We have the ability to get in here and shape this right now too, which is really exciting.
Yeah, absolutely.
Yeah. Well, you mentioned the current turmoil, and I think it just maybe a couple minutes, but in the current funding climate, I think in speaking with you, I think in Alaska recently, you're able to look at this in a positive way and say that the game is changing, but let's play the game as it is. Bring it on, right? Is what you said. So, so in the current funding climate, what do you? I guess I'll focus on NWRPCA. What is the PCA's role in? Is it advocacy? Is it again enabling conversations about new models? What do you think is a good responsive posture is right now?
Well, I'd say the first thing is, regardless of what your politics are, where you are on the spectrum, left, right, is, the MAHA, the Making America Healthy Again approach, in the 4 key bullets that the Congressional MAHA Caucus has identified. One of them is very explicitly around primary care and community health centers as an opportunity. I mean, tell me that's not a real opportunity. That plus thinking about food as medicine and the nutritional aspects here. So I do think, yeah, and I remember when we spoke in Anchorage, I still feel that sense of, yes, I get it. The challenges, the issues, obviously with OB3, the passage of the bill, and what we'll see with Medicaid, don't want to take away from the huge challenges. And I think it's time for us to really frame where the health centers are, the role we're playing. We're serving 34 million people. We're in what, 15,600 different sites, 1,400 different organizations around the country. Do you think about the role we could play in really addressing healthcare, not just medical care, not just, outpatient primary care, but really thinking about those elements around going upstream with preventive care, and then thinking about nutritional elements there. Kind of the infrastructure that we provide as an opportunity to chronic illness. That's one of the key elements for this administration, is addressing chronic illnesses and looking all the way at kind of early childhood chronic illnesses. Again, health centers are really well positioned for that. So, I'd say, we just looking at this and saying, where's the opportunity here? I think in any situation.
No matter how that problem is defined, community health centers are the part of the solution. And
Yeah.
and that's been encouraging along the way for sure. So,
And how do we, if I could just add, how do we keep thinking about, to your point around AI and other elements, how do we bring in the technologies? How do we think about the changing, landscape around how people look at their health, their access to information via the internet, via apps, to what extent they're getting care remotely in their homes through different technologies. All that should be what we're factoring in to what I'd call the new health center model for the next 60 years.
absolutely. I'm so excited about the relationships that AI can find in data that we've never had before.
Yeah.
And you talked about the other factors at play in an individual's health beyond what we see in our four walls. And now those relationships will be in different data pools, and it's harder to see. We have this intervention. Does it make the same difference? Is it more important to have, is the nutrition or the housing situation just as impactful on the healthcare? We know this in a lot of ways, but we haven't been able to show it sometimes in data. And I think using AI in databases that are not mapped early on, looking at this already, that we're going to be able to pull a lot of relationships out, a lot of causation out, and it's going to be very interesting, and hopefully will even help enable some additional funding in places we know we need it. So.
Yeah, all these pieces could tie together really beautifully if we can just keep working at it.
So I think AI is probably part of this last question, but I wanted to ask you, just looking ahead, what do you think, maybe a minute on the biggest opportunities for us as health centers, for the health centers, and maybe you want to start with a couple of the threats. Like what are the biggest concerns in the next couple of years that you're keeping on your radar, and then where do you think the opportunities are we're driving toward?
Yeah, I think, and as you well know, the financial challenges that our health centers are experiencing, kind of a little bit the perfect storm, or at least the significant storm that's hit around the COVID funding that we had supporting that, around workforce challenges, with shortages and leading to reimbursement issues, thinking about inflation, thinking about all the pressures, 340B and some of the pressures on that. So that's one of the big challenges. I know that's a concern to me, I imagine to you, to all of us, around just sustaining the whole health center infrastructure. We're already seeing some of our centers really struggling and trying to keep their doors open. So that's one area. I think and part of that is obviously the impact that OB3 will have, the bill just passed, will have on Medicaid and the workforce requirements and the likely loss of Medicaid coverage for many lives. And that's all of those, how we're anticipating and preparing for that is pretty existential. I mean, it's kind of one of the most significant threats since I've been working in the health center world. So I was saying earlier about really kind of keeping the positive approach, really looking at the opportunities. We got to do it with very realistic, viewpoints. Kind of what do we dig into? And so in some ways, I think that what we dig into is exactly the core model of the health centers. What has been successful in providing care to folks, what has kept them out of the emergency room, out of hospitals long term. That it kind of comes back to that same thing. So I think when you talk about the challenges, I definitely think workforce, and how we are, identifying, training, recruiting, and retaining really good folks. So we have to be thinking, I think, more as a system around career development for our best. If folks are moving, we have a very mobile society, and if folks are moving, we should, we're across the country. We should be able to kind of help refer folks and keep people in the health center world. So, that's just one element of the workforce challenge. But I do think we can be better about, being proactive, identifying and getting people interested in working in a health center. I mean, there's always the employer of choice element. We've got to be solid employers from the board level to the administrator level to all the way down, so that a health center is a place where people want to, go, and then they want to stay. for their career. So yeah, that with kind of the financial pressures that health centers are experiencing, and then thinking about care delivery and the transformation of care delivery, and thinking about how we be creative, how we stay on the edge of what patients really are looking for. If they want better access, if they want, our information in advance, if the kind of the customer service component, we really have to meet people where they are. Patients vote with their feet, right? They'll go where they feel most respected in a sense, and their needs are cared for. And I think health centers, we got to stay on top of that.
So in that space, the customer, the patient as a customer, you feel like are you seeing that there are opportunities for us to improve in that? Is that what you're saying? That's maybe an area where we really focus on that, and being an employer of choice are areas where maybe health centers aren't as at the very top of their game yet, and that's a really critical piece the next couple of years.
Absolutely, completely. And I would say I think we've got a strong foundation in history. When you think about culturally sensitive care, you think about comprehensive care, we think about integration of behavioral health, oral health, kind of the elements that have made health centers, I think successful in serving so many patients to date. But it's like that classic thing of what got you from there to here ain't necessarily going to get you from here going forward. So I do think, the whole notion of health and healthcare in this country is changing. How we access information, whether it's the internet, whether it's other elements. So I think we've really got to be on top of when we talk about patient-centered. Even there, I'd say that's a dated concept, because that's implying kind of a historical notion of the patient. If we really think of kind of individuals, and we approach it as not just the patient in a care system, but the individual in a community, and what supports an individual in really thriving. Really short story is an older guy, and one of the docs was telling me the story. The older guy that he was been seeing for a number of years, he finally, he wasn't really following his meds very carefully. There were some challenges in that, and the doc finally asked him, so what really matters to you most? And the guy said, listen, I want to be around so that I can play with my grandson. I really want to be able to be healthy and be able to do that. So they started really working on his plan with that. It was really person-centered. It was really personalized, and there was the relationship behind it. It's kind of going back to that old-fashioned notion of the family doc in the neighborhood, is really listening and paying attention. I know productivity issues make it challenging, right? I get the concerns, but that bedside manner, that really connecting with people and understanding what drives them, what excites any of us. We're all patients, right? Not only how do we want to be respected? And what is it that what connects with me is when someone's really interested in kind of what it is that I am trying to do, and then are listening and helping that. And I want to be able to, for us, the health center system, to do the same in turn. But it does feel like it really is about how we're going back to that sense of really, understanding and responding with the technologies we have, with the care teams we bring forward. We have comprehensive care teams that can do handoffs, whether it's being behavioral health and other elements, start bringing more vision care into it. So I think maybe a vision I'd say around this is that how do we, build from our origins towards that notion of really supporting not only the individual in his or her or their community, but we support the community. We're really getting at what does the community most need around these issues too, and and be involved. So I think health centers really being involved with community partners to be seen as not just a clinic that you go to, but that a partner that is reaching out and is involved with employment agencies, involved with transportation, is involved with the whole range of issues, nutritional, addressing food deserts. So you can see, you ask me a question, I get going. You got to cut me off, Joe.
I love it. No, I love it. This is fantastic. I think it's great that we touched on AI earlier. I think the ambient scribe technology, to be really narrow for a moment, is taking out the documentation elements. And I was just talking to these health centers. As we do a security risk assessment, we're looking, for health centers, we look at the security, privacy issues. But I think not moving in the direction of AI for your scribing is a risk, because I don't think you're going to be able to recruit providers if you have that. But what it does is what I'm hearing from the clinicians is they can focus in on the patient in a way they haven't been able to in years.
Absolutely.
They're not typing. They're not, their notes are done at the end of it. And so there's a number of solutions out there in the market I know that we're running into that do this well, and I've heard just great testimonials. So I think hopefully this very specific implementation of AI will support the vision you just laid out, Bruce, of how we treat the patients as an individual and get to know them and bring back some of those family doc style relationships, and then plug into
engage with them, right?
Yeah, absolutely.
Right. I mean, it comes back to, when you're engaging with someone or you're not, or if they're engaging with you or not. It's not rocket science. I mean, this is the stuff I think we really gotta make sure we're sticking to.
I think technology will help support it. I think the everything else that you do to wrap around it, create the space for these conversations and for best practice sharing is going to enable it. So thank you so much for what you do, Bruce. Thank you for the organization's work for the communities that you serve around the Northwest. And thanks for spending some time with us to talk through it as well. Yeah.
Well, it's nice of you to say, but honestly, Joe, and I'm not just throwing this back, is Medcurity and partners like that are, I mean, really, it's I use the soccer analogy. If we're out on the field and we're playing with each other and we're really kind of listening to and learning how to play, then we could be a hell of a team, nationally around this stuff, the combination of folks. I really mean it.
Absolutely. I see it. We want to be those kind of partners with you. So we really appreciate the partnership. You guys are wonderful. So thank you again, Bruce. Appreciate the time. Take care.
Thank you, Joe. Hopefully see you in Spokane.
That sounds great. We'll be there.